Giving birth is, well, one of the most intense experiences you can go through. But what if I told you that some of the most common advice out there actually makes it harder? Today, we're breaking down 3 huge mistakes that so many people make during labor, and this is all based on advice from certified doula Stephanie P. So let's just dive right in and figure out how you can prepare for a smoother, more confident birth. I mean, really think about that question. So many of us go into birth just relying on what we've heard, right? But we don't realize that some of that advice could actually be working against us. Now, the goal here isn't to scare you at all. It's to empower you, to give you the knowledge you need so you can advocate for a much better experience. Okay, so the first mistake we're going to tackle is a big one. It's this idea of just trying to breathe through it without actually knowing how to breathe in an effective way. I know, it sounds almost too simple, but the way you breathe sends these incredibly powerful signals all throughout your body during labor. Now, this is what's so fascinating. Our breathing directly controls our physical state. Think about it. Short, shallow breaths, that's what you do when you're scared. It's fight or flight. It basically tells your body, hey, we're in danger, and everything tenses up, which, you guessed it, makes contractions feel way more intense. But on the flip side, slow, deep breathing signals safety. It tells your system to chill out, to relax, and to work with the process, not against it. And this quote just nails it. Here's the thing, you can't fool your own body. If you practice this kind of controlled, deep breathing, you are actively telling your nervous system, I'm safe, it's okay, this isn't a threat. And trust me, that biological response can make a world of difference in how you manage pain and progress through labor. All right, let's move on to mistake number 2, which is all about that final stage, pushing. And oh boy, is there a huge myth that we need to bust right now. Yup, you've probably heard this one. It's one of the most common things people are told in the delivery room. But according to our source, it's not just inaccurate, it can be a really big mistake. Pushing needs to be way more controlled and in sync with what your body is naturally doing. So that advice often leads to something called purple pushing. You know, when someone's telling you to push, hold your breath, and bear down with every ounce of your strength, often because a monitor says it's time or a provider just tells you to go. But that's totally disconnected from what your body is trying to do. It's like you're fighting the system, and that can lead to total exhaustion and even injury. So what's the real secret? It's this. You have to work with your contractions. Your body is already doing the heavy lifting to bring that baby down. Your job is to feel that wave, that natural urge, and then push along with it. And when the contraction ends, you stop, you rest. You're following your body's lead, not trying to overpower it. And that brings us to the third and, possibly the most important mistake of all, not fully understanding your own role in the delivery room. And that role is being your own biggest advocate. This is all about who you rely on for information when you're actually in labor. It is absolutely crucial to understand this difference. Look, the hospital staff, the doctors, the nurses, they are amazing, and their #1 priority is medical safety. They are tracking vitals, they're managing procedures, and they're documenting everything to make sure you and the baby have a safe medical outcome. But your priority also includes the experience itself, feeling confident, feeling comfortable, feeling in control. These are 2 different, though obviously related, goals. So why can't you just let them guide you through everything? Well, a lot of their advice is based on standard procedure, not necessarily what's uniquely best for you. And here's the critical part. When you are in the middle of active labor, you do not have the mental bandwidth to learn new breathing techniques, or debate different pushing styles, or try to coach your support person. All of that prep work, all of that communication, it has to happen before you're in the thick of it. So let's bring all this home with one final, really powerful idea that kind of reframes the entire experience of giving birth. It's all about a shift in your mindset, from being a passive patient to being an active participant. This right here is the biggest takeaway. When birth happens to you, it feels like something you have no control over, like you're just a passenger on a ride and people are telling you what to do. But when you're prepared, when you understand your breathing, your pushing, and your role as an advocate, you can allow the experience to happen through you. You become a key player, working with your body and your team to bring your baby into the world. Ultimately, avoiding these common mistakes isn't just about trying to have an easier labor. It's about stepping into the main character role of your own birth story. So the final question I want to leave you with is this. You are the lead in this story. So how are you going to prepare for the role?